Welcome to the Orientation to Traumatic Brain Injury, HASCI, and Similar Disabilities. At the end of this presentation, please navigate to the exam attached and complete it to the best of your abilities. The effect of a spinal cord injury on the rest of the body. Breathing C3, C4, and C5 spinal cord injured, SCI, can stop breathing and may require ventilator support. Once pulmonary function improves, C4 injuries and lower can usually be weaned from the vent. Irregular heartbeat and low blood pressure. Spinal cord injuries at the cervical level are often followed by fluctuating blood pressure and heart arrhythmias. The heart can beat at a dangerously slow pace or pound rapidly and irregularly. Caregivers should be aware of their client's baseline. Low blood pressure often occurs due to a loss of tone in the blood vessels. Treatment is usually to increase fluids to build up blood volume. Blood clots. People with SCI are at triple the risk for blood clots. Anticoagulation drug therapy may be prescribed to be used as a preventative measure. Caregivers should encourage SCI to avoid sharp objects. Caregivers should also encourage SCI to avoid over-the-counter anticoagulants, such as ASA, if their doctor has prescribed another form of anticoagulation therapy. Caregivers should report small red rashes, which may indicate too much anticoagulant. The rashes are called petechiae. Spasms. Reflex movements controlled by the spinal cord but regulated by the brain may not be able to get through to the CNS to regulate activity. Reflexes may become exaggerated, causing spasticity. Medical and surgical treatments are highly successful. They include oral meds like baclofen, dantrolene, diazepam, or baclofen pumps. Autonomic dysreflexia, a life-threatening reflex action, occurs due to irritation, pain, or stimulus to the nervous system below the level of injury. The irritated area tries to send a signal to the brain, but since it's blocked, a reflex action occurs. Autonomic dysreflexia signs and symptoms: slow heart rate under 60, blotching of skin and redness of face, flushed, restlessness, BP over 200 over 100, nausea, cold, clammy skin below the level of injury, pounding headache due to high blood pressure, goosebumps, sweating above the injury, and nasal congestion. Anything that causes pain or irritation can set off AD, such as the urge to urinate or defecate, pressure sores, cuts, burns, bruises, sunburns, pressure of any kind on the body, maybe tight clothes, ingrown toenails. Autonomic dysreflexia. What to look for? Treatment should be swift. Remain in a sitting position, but try to release any known pressure immediately. Empty the bladder. Unkink the catheter if needed. Unclog catheter. Perform a catheterization, etc. Empty the bowels. Perform digital stimulation. If you were doing this when the symptoms started, stop. Wait for symptoms to subside, and then resume. Remove or loosen tight clothing. Look for pressure sores, ingrown toenails, or fractured bones. Bladder problems. The bladder may empty suddenly without warning or become overfull without releasing. The bladder may release, but urine backs up into the kidneys because it isn't able to get past the urethral sphincter. Most SCI use either intermittent catheterization or an indwelling catheter to empty their bladders. Research is focusing on electrical stimulation and neuromodulation for control of the bladder. The anal sphincter muscle can remain tight so that the bowel movements happen on a reflex basis whenever the bowel is full. Or the muscle can be permanently relaxed, which is called a flaccid bowel, and result in an inability to have a bowel movement. SCI people are usually put on a regularly scheduled bowel program to prevent accidents. Pain. Most SCI have neurogenic pain. Pain can be difficult to control. Treatments include medications, acupuncture, spinal or brain electrical stimulation, and surgery. Sexual function. Most SCI women remain fertile and can conceive and bear children. Even those with severe injury may well retain orgasmic function, although many lose some, if not all, of the ability to reach satisfaction. Men may have problems with erections and ejaculations. Most men have problems with fertility and sperm motility. Treatments for men include vibratory or electrical stimulation and drugs like Viagra. Pressure sores. Since SCI reduces or eliminates sensation below the injury, people may not be aware of the normal signals to change position and must be shifted periodically by a caregiver. Good nutrition and hygiene can also help. Pneumonia. Respiratory complications remain a problem due to decreased ability to cough and clear secretions. Caregivers want to encourage deep breathing and cough exercises whenever possible. Caregivers should encourage the client to maintain at least a 30-degree angle before drinking fluids. Encourage SCI persons to chew their fluid and swallow carefully at all times to prevent aspiration pneumonia. Assist the SCI to dress appropriately for the weather when going out. Research. Can an injured spinal cord be rebuilt? This is the question driving research. There are no known cures yet, but research on stem cells and more is delivering hope. The future of spinal cord research. Fueled by significant federal and private funding, the past decade of spinal cord injury research has produced a wealth of discoveries that are making the repair of injured spinal cords a reachable goal. This is good news to the 10 to 12,000 Americans every year who sustain these traumatic injuries. This is the end of the slideshow. Please proceed to the exam and complete it to the best of your ability.